Hi there, welcome. My name is Mo. Welcome to my channel, Mo Moon. I'm going to continue on with this Neo Pagan November challenge. The prompt for day 21 is community. Neo Pagan November is a month-long challenge started by Brittany, the Sunshine State Witch. And it's definitely a challenge, but it's good to be challenged, so I'm happy about that. So, when I think about community, I think about a group of individuals that support, encourage, and have something of similarity. So when I think about community, people that I think about that support, encourage, and are similar to me, who have a similar goal, would be the group of people that I work with in the intensive care unit in the local community hospital that I work in. It is a local community hospital because it serves a lot of the surrounding cities, and there are bigger hospitals further out, much bigger hospitals, newer hospitals. Our community hospital is 4 floors where we have patients. The 5th floor is the laboratory and offices, and the 6th floor is where they take care of the machinery, so we don't go to the 6th floor. So we have 4 floors where we keep patients, where we take care of the patients. And on each floor there are 4 wings: north, south, east, and west. So this is a community hospital, like I said, and it's quite an old hospital. If I'm not mistaken, I think it was founded in the 1950s, if I'm not mistaken. So it's quite an old hospital. And so some of the units look very run down, and the people that take care of the hospital are slowly renovating and painting and upkeeping the hospital. So I work in ICU, the intensive care unit, and I work with a community of healthcare professionals to take care of the patients that are in critical condition. Now, I've worked in ICU now for almost 3 years, and I can definitely say that the people that I work with, it feels like I'm in a community of people who understand me, who support me, who think highly of me, who like my work ethic, and who appreciate my work. And it's always nice to be appreciated when you're in a community. In the ICU, I work with nurses. I work with I don't work with the doctors one-on-one, although I did help one of the doctors by holding a patient's arm the other day while he put in a line in the arm, a peripheral line or some sort of IV, intravenous line in the arm. I had to hold the patient's arm while the doctor took care of that. And he was very nice. He said thank you when he was done. He said he couldn't have done it without me. So I don't work directly with the doctors. Like, I don't usually talk to them. I do say hi, but it's mostly the nurses that work with the doctors and talk to the doctors and report about how the patients are doing. In the ICU, we don't have any nursing assistants. We just have nurses and doctors, and we also have the respiratory therapists. So there are a small group of respiratory therapists who take care of giving the medication that are the puffers for the lungs, and who take care of the ventilation systems that the patients are on, because a lot of the patients are intubated. They have a tube going into their throat, into their lungs, helping them breathe. So the respiratory therapists help the nurses when the patient's oxygen is going too low, they come in and see what they can do to bring the patient's oxygen up so that they, can be well perfused with oxygen and not lose too much oxygen, because that can be detrimental to their health. So we have nurses, respiratory therapists, doctors, and then we have somebody who stocks our shelves, and we have housekeepers who come in and clean our rooms for us and empty our garbages. And I am friends with people from each category. I know a lot of the housekeepers by name, not just in ICU, but in the hospital. But in ICU specifically, in that community, I know the housekeepers that come in to empty our garbages and clean our rooms. And I know the respiratory therapists by name, they know me. I know most of the nurses who work the same shift as me, and I know some of the nurses that work the other shifts. And we work together for the patient. And we try to make sure we have a good time doing it. We try to keep the vibe high. We help each other a lot. We often, if somebody is free, they'll go around asking if anyone needs help, because we're there for the patient. So in our community hospital, the ICU community that I work in, we get a lot of people who thank us with cards when they get out of the hospital. They send thank you cards. Often we get gifts of gratitude, which, chocolate, cookies. A lot of people are very grateful for the help that they get in the intensive care unit, and they often thank the whole team. And that's what we are. We're a team. We're a community of people who know that we're not there for each other, although we do help each other. We're there specifically to help the patient. And I feel like we're even there to be friends. A lot of my colleagues are good friends with each other, and oftentimes if it's quiet, we'll be able to just have a quick chat, sit down and chat with each other, and get to know each other a little bit better. It's a very tight community. It's a very welcoming community. It's a community that works hard. As you may or may not know, a lot of the hospitals here, where I am in Canada, we're short-staffed. So a lot of the times we'll be working alone, but I'll be working alone. I usually work with someone else, but if I'm alone, the nurses, they help me out. Even though they're not doing the same job as me, they're willing to put themselves in my shoes and help me out with my own job, like whether it be cleaning the room or bringing a patient upstairs, or just being emptying their own urine Foley bags, or just being understanding and being patient with me while I take care of helping those that I can one at a time. And often the nurses have to do overtime, 12-hour shifts, because we are often short-staffed, and yet, nobody, it's very important to put your health first, and if you feel burnt out, you need to let people know. But at the same time, when the nurses do have the energy and they are needed, they put in the energy that they need to continue their shift and take care of the patient. So for me, when I think of community, I think about my colleagues, and I think about the community hospital that I work in. And, even though people can talk bad about our hospital, a lot of the people that I know who work there enjoy their job. They enjoy helping the patients. They work hard, and they're just all around good people. Of course, you get some people who are more difficult to work with. Sometimes you get people who are lazy. But the group that I work with in the intensive care unit, everyone pulls their own weight. Everyone is very helpful, and I feel accepted by that community. I feel honored to work with, like I said, these healthcare professionals who are so intelligent and saving people's lives, who are in critical care, and you know, doing it with a grateful heart and with a loving heart. So that's what I think about when I think about community. I think about the nurses and all of the other people that I work with in the hospital. So that's it for my prompt for community. I hope it was helpful for you to hear a little bit about the hospital, and I will see you in my next video. Bye.